This video will demonstrate how to assess the shoulder mobility, strength and flexibility. At the shoulder, there are 8 main movements. These consist of flexion, extension, abduction, adduction, external rotation, internal rotation, horizontal abduction and horizontal adduction. In order to assess these movements, I will begin by doing active movements. When a person performs an active movement, it means they are using their own muscles to perform the movement without any assistance. This is done to review the client's range of motion and to assess for any pain in each movement. In the video, I begin by actively assessing shoulder flexion followed by extension. Then I assess external rotation followed by internal rotation. I then actively assess shoulder abduction followed by shoulder adduction. Next, I assess shoulder horizontal adduction, which is bringing the arm forward across the body, followed by horizontal abduction, which is moving the arm forward across the body and moving it backwards. Then I do scapular retraction. After that is followed by scapular protraction. Then finally, elevation of the scapula followed by retraction is completed. As I perform these exercises, I assess if there's any differences in range of motion and also if the client is in any pain. Now I move on to passive movements. Passive movements refer to movements of a person's body parts that are executed by an external force. While doing this, the client's muscles don't contract, and I will take the client through each individual movement. It is best for the patient to be completely relaxed in order for me to get the end feel of each joint and show no resistance. I begin by passively assessing shoulder flexion, which is raising the arm forwards. As I do this, I have the client in a seated position. This is because the client is taller. I then assess extension of the glenohumeral joint, which is moving the arm back. Next, I abduct the shoulder, which is raising the arm sideways. Then, I externally rotate the shoulder, which is rotating the arm outwards. Then, I place the arm in an internally rotated position behind the back. I do this when internally rotating in front of the body. It can be difficult to get the full range of motion, as the body of the individual can get in the way. Then I adduct the arm, which is moving the arm inwards. I do this in a standing position as the knees of the individual can get in the way while seated. Passive movements can be very useful in order to determine any abnormalities in a client's shoulder mobility. Passive movements can be used in order to describe the amount of pain a client is in. It also can highlight what movement a client is in pain with to help diagnose any injuries, but also give the practitioner an idea on what sort of rehab exercises can be beneficial. When doing these movements, as a practitioner, I will pay attention to the facial expressions of the client. I will also listen to any subjective markers made from the client in order to determine the amount of pain they're in. I also passively assessed horizontal adduction, followed by horizontal abduction. I did this in a seated position due to the client being taller, making it easier. Finally, I will assess resisted movements. These are where the patient actively contracts their muscles against resistance provided by an external force. These movements are used to evaluate muscle strength, power and function. By applying resistance to specific movements, it is possible to assess strength of individual muscle groups and identify any weaknesses or imbalances that may be present. I begin by using an isotonic movement to assess shoulder flexion. Isotonic movements are when the muscle length changes during being under resistance. This is where I resist the entirety of the range from the start to the end, where isometric movements are those where the muscle length doesn't change while being under resistance. Next, I use an isometric movement to assess extension of the shoulder, followed by doing an isotonic external rotation of the shoulder. Then, after this, I do an isometric hold straight after. I then go into abduction, resisted movements at the shoulder, which is an isotonic hold, followed by an isometric hold while doing shoulder adduction. Resistant movements are used in order to evaluate a patient's muscle strength and also to identify weakness and imbalances. It can also be used to identify progression over time. and also it's a very valuable tool for planning different treatment methods. Finally, this is an example of an isotonic movement when performing horizontal abduction. It is then followed by horizontal adduction, which is also an isotonic movement. The functional test I've used for shoulder is the press-up. I use this exercise as it challenges the stability of the shoulder and makes sure everything is aligned. It also requires full range of motion to complete. This will give good indication of at what point the patient could be feeling pain, and it also requires a lot of strength in order to do a press-up. Evaluating the ability to perform a press-up assesses the strength and endurance of these muscles. When the client performs this movement, I'll be looking at facial expressions and also asking questions like how does that feel to see how much pain they're actually in.